This is Dr. Verdiales from the Georgia office. It's been a few weeks that we've gotten together, so here we are again. So I always like to talk about a few things as we start and then go over the questions that you might have. So I want to take the opportunity to talk about anti-aging, okay? And why am I picking that subject in a fertility forum? Because it's all linked together, okay? A lot of the techniques that are used for anti-aging can be used to improve your fertility journey, since it's the same vessel. I always talk about 5 things that are needed to have a baby. One is a good egg, good sperm, and a good uterus, fallopian tube, and a good vessel. And this is the vessel. All right, you are the vessel that will be carrying this pregnancy. So anything that's going to help your overall health is going to be beneficial in terms of the anti-aging. And anti-aging then can be used for fertility because it's the same type of tissue. If it's good to make you look young and it's for the skin, ovarian tissue is epithelial tissue. So it can be used in a similar sense. So a lot of the techniques that are used in the cosmetic world can be extrapolated to the fertility world. And a lot of the techniques that are used in the wellness and anti-aging crowd can be used in fertility. So let's talk about a few of these things. I'm going to go over diet, okay? Why do you eliminate certain foods when you're talking about anti-aging and fertility? One, because anything that could cause any allergic reaction or has a high antigenic content is going to impact the immune system in a negative way, and then the immune system will not be able to be used for healing, therefore anti-aging and regeneration. The immune system is extremely important in the regeneration process of your body. So one, everybody knows the immune system because it's used for protecting from invading, bacteria and viruses and other microbials, but it is also used in the cleaning, okay, of your body. So the immune system is crucial to avoiding having cancer, for example. Why? Because you are a giant factory, and then there's always going to be defective cells. So your quality control is actually the immune system. And at the same time, as the immune system is cleaning defective and old cells, is provoking regeneration of the tissue. So if you eliminate foods that could interrupt that process, you're using your resources and energy in the area of interest, regeneration and healing, all right? Energy is never lost, right? It is transformed. So if you have X amount of energy that is being used here to protect you against foreign invaders and internal antigens, then it cannot be used here. Simple as that. Intermittent fasting or fasting. There's a lot of research about how fasting causes apoptosis, okay? So that's programmed cell death, and it helps the old cells be eliminated, allowing newer cells to come in. So there's even an institute at the University of California in San Francisco that studies the effect of prolonged fasting in anti-aging and how, like, it naturally, for example, everybody talks about human growth hormone and Omnitrope and Cerevital, that I see that Jen mentioned that, and increasing your, natural human growth hormone. The fastest way to increase natural secretion of human growth hormone is fasting. So they've done all these studies about what happens in the fasting state and how our natural healing and growth hormones go up. So something as simple as starting with an 18-hour fast, and it might seem hard in the beginning, so you might want to add a little bit of time to get to at least 18 hours. Could be the difference between having better eggs and not so good eggs, right? The idea that we should be eating every 3 hours is actually incorrect because it does not allow the system. If you have your body working in digestion all the time, then again, energy cannot be destroyed, right? It's only transformed. It's only moved from here to here. So if you're using all of your energy for digestion and for processing junk inside of you, whether you put it in or it's in the environment, you don't have energy to heal and regenerate. Then we talk about the PRP. PRP actually started, and for those of you who, have spoken about this and have heard me before, PRP, platelet-rich plasma, is harvesting your own healing proteins associated with the platelets, and then putting them where we want them. The first people in the healthcare industry to use that was the maxillofacial surgeons, but the next group was actually cosmetic. It became really famous with the vampire facelift. And why is that? Because you create, with microneedling, for example, in the face, a little insult, and then put those healing proteins. So those cells, the collagen fibers and the elastins, regenerate, right, and get a more youthful look. And then that's why they call it vampire facelift, because you're using blood or blood components to create that tightening and plumpier skin that gets created from PRP in the face. So I'm using different examples to show you how. Can you guys hear me? Okay. So I'm using different examples to show how. Okay. Well, maybe I'll put this on. Do you guys hear me better like this? Maybe you can hear me better with this headset on. All right. So I'm using different examples to show you how the anti-aging and cosmetic stuff that's out there can actually be used um, for fertility, because it's the same thing. Skin has the same type of tissue as ovaries, has the same type of tissue as the epithelial cells, has the same type of tissue as the uterus. And that's where some of this, sorry about that, guys, computer issues. Same type of issues as, I'm sorry, same type of tissue as your skin. Hair, for example, PRP on the hair, and how it helps the scalp regenerate and cause rejuvenation of those hair follicles, and then for them to get stronger and start coming out as well. A few new things that we've been playing with at the Georgia office is IV infusions. So nutrition infusions with multivitamins, with good glutathione, which is a natural antioxidant, anti-aging, supports the liver, and the NAD, which has been shown in rats to help reverse menopause. So we're adding that to the different tools in the toolbox to help not only on the cosmetic and wellness side, okay, because we have a whole wellness clinic, but also, again, all of these techniques that are used on this side help the fertility. So, like I said, I found we've been using IV infusions and nutrition infusions for weight loss and wellness and anti-aging, but it's starting to cross over. And I did find a few papers on rats, on animal studies right now, on NAD and how it helps reverse early menopause. Okay. So I'm going to start answering some of your questions. My friend said that, why are you taking Serovital with stims? I said, because they don't want me to have wrinkles. That's cute. That's cute.
Um, okay. Yes, yes. So, so I have one of you talk to me about just completed a retrievals and banked 28 day threes. That's absolutely awesome. Congratulations on that. I do talk to my 40 plus ladies about embryo banking and the importance of doing that because you could have your entire family frozen. And I've seen that. I have a beautiful patient from New York, and she in her mid 30s banked eggs, right? She banked eggs, then um, got married, wanted to wait a little bit. And I met her during her fertility journey. She had the eggs that she did not want to use immediately, as a backup plan. So we were working with her eggs. She is one of my PRP ladies. We did a series of high volume PRP. Her AMH was low when I met her. So her first cycle of IVF was not very successful. Well, she ended up getting pregnant on priming, which happens very often. She got pregnant at 40 with her beautiful son. And now, when we talked again, she was mid 41. So her son was 18 months, and she wanted to go for baby number two, but her AMH had dropped to zero point 0.1, and her FSH kept kind of fluctuating up and down. Well, guess what? She had banked eggs at 35. So she was going to use her banked eggs for baby number two. So hopefully it works. I haven't spoken to her in a while. Is collagen good? Collagen, there's a lot of debate about ingesting collagen and whether it actually makes it to your system. We could argue that ingesting collagen indirectly might be good because it will be broken down in your gastrointestinal system and provide the tools for your body to make your own. But when you actually have collagen ingested, it will not be, you're not ingesting collagen and that's going to go and replace your own. It has to, especially if you're ingesting it, it's going to go through the entire system. So indirectly, it could again provide the building blocks for your body to make your own again. I would prefer to see more of ingesting those building blocks, whether it's collagen. My personal, I don't really take collagen. What I do is bone broth. Okay, I do a lot of organ meats and organ meat pills. They're fantastic. There's one of bone marrow that I take that because it's the crush bone. It has cartilage, it has bone marrow, and therefore it has collagen in it. And then when you load up orally with good stuff and then go superficially with techniques like microneedling and PRP, then your body is going to have what you're ingesting with the stimulation of all these healing proteins and and all the the multiple techniques to do this, and then improve the quality of your collagen that way. How often do you recommend these IV infusions with NAD and glutathione? Weekly. I have a 45-year-old lady right now. She's actually, you could do it up to 3 times a week, but at least weekly as part of your priming, all the way to maybe at the beginning of stim. I would not do it past that, especially because of the NAD can cause a little bit of dilution, anticoagulation, and you don't really want to, put that into the mix heading towards the retrieval. What is the benefit of Serovital? So Serovital is a trademark. It's a trademark supplement, and when you look at the ingredients, it has a list of amino acids and vitamins that has been suggested to increase your natural production of human growth hormone. There's nothing in the Serovital. I've taken it. I've I've experimented with stuff. My personal mission is this life is to find stuff that improves my life. And when I find something good, share it with others. So I've taken Serovital. There's nothing in there that's going to be detrimental. It can only be beneficial. I did not feel any different. That doesn't mean that things weren't happening. But actually, even better than Serovital, it is the fasting. Cost 18 to 24-hour fast is it's a killer to cause an increase in production of autologous human growth hormone. How soon after PTP is IUI done? What is PTP? I don't know. Oh, PRP. Okay. How soon after PRP is IUI done? When you're doing PRP, especially the high volume technique, you want to do it after your period and before ovulation. So you can do the IUI 24 hours after the PRP. If you have some of if you have someone that will donate her embryos, when is the process? Okay. So if you're looking into embryo donation, you have to you can contact somebody directly. There's multiple support groups out there that could point you in the right direction. Direct donation of embryos is the best way to go. If you go into the waiting list for embryo donation, it could take a few months. You're better off buying eggs and buying sperm and creating your donated embryos. Really, that will be a lot faster. What about laser light therapy or red light therapy? Absolutely, especially when you have the red light therapy in conjunction with infrared. So it covers different layers of the body and skin and in somebody that's fairly thin, you can actually put that infrared on your abdomen and potentially help little dipper tissues, including ovaries, with anti-aging and collagen formation and epithelial rejuvenation, etc. I have my friend, oh my God, oh, I'm blanking. Waters. She's a a acupuncturist in the Syracuse office. She sold me one of those infrared machines, and it is fantastic. You can really feel the difference in terms of energy and clarity. Jennifer. 42 with an age of 0.98, one full-term pregnancy, just getting started, some testing hopefully happening next week. Absolutely, Susan. There are many things that you could do. An AMH of almost 1 at 42 is fantastic. In this life, in general, you should celebrate everything, even the small, or what seems to be small victories, which is an AMH of almost 1 at your age is awesome. So it's pretty good. Things that you can do, everything that I've been describing about anti-aging, you really want to get off grains, wheat, corn, soy, oats. You want to get off whole milk, okay? Whole milk, especially pasteurized milk, is very inflammatory for the mucosa, okay? Causes a lot of allergic reaction, a lot of mucusy production. Well, the mucosa and your ovaries and your uterus and your vagina, it's all the same tissue again. It's that, epithelial with mucus, gland type of tissue. So it's very inflammatory for that. Wheat and gluten is terrible for your endocrine system. So you want to clean your diet up. Nightshades are very inflammatory. So peanuts, cashews, beans, peppers, tomatoes, very inflammatory, cause a lot of allergies in a lot of people. So you want to take out of your diet anything that is like allergy type of stuff, okay? That is huge. Then intermittent fasting. I tell my patients, if you can't do intermittent fasting every day, try Monday, Wednesday, Friday, where you skip breakfast. And it's like skipping breakfast. It's just water only. Have your first meal at 12 or 1 p.m. Okay. You want to get on CoQ10. You want to get on a good prenatal. What do I say with a good prenatal? You want it to be on a food base or be food based completely. There's several brands out there that are really good. You want to get on vitamin D. Vitamin D is crucial for hormone production and for our steroid based hormones. Um, and it's actually in certain circles, vitamin D is considered a hormone and not really a vitamin because you actually create it yourself on the skin when you have enough sunlight. So vitamin D, CoQ10, a good prenatal, that would be the very basic. The diet, very, very basic. The intermittent fasting, very, very basic. If you have access to the IV infusions that I'm saying, PRP, if your tubes are open, we can do high volume PRP on a serial. And and I usually, with my 40 plus ladies, I like to do priming in conjunction with oral ovulation medication, and that serves several purposes. One, if you get pregnant, hallelujah, that's the whole point, right? It's not getting ready for IVF. You just want to get pregnant. Two, it helps with priming the system. How do you build a muscle? You take it to the gym, right? And then you're rested and you take it to the gym. So that's kind of where I'm going with doing priming, but actually doing ovulation induction. And if you don't get pregnant during priming, you're not losing your time. You're getting ready to do the next step on your fertility journey and you're improving your baselines. A lot of times on the 40 plus ladies with decreased ovarian reserve, I see that their baselines are not clean. What do I mean with that? Low estrogen, low FSH, low LH, the ratio of FSH to LH. FSH needs to be higher than LH. Um, all of those things get improved when you do ovulation induction, leading to the actual treatment cycle. Does sperm mobility impact pregnancy chances through IVF? Yes, it does, depending on how severe it is and if there's other parameters in the semen analysis that are suboptimal. With IVF through our clinic, it's ICSI, so they will pick the healthiest looking sperm. But if there are multiple parameters that are not optimal, then we could look into that, and if that's an issue with your partner, then genetic testing, blood work. I mean, are we dealing with low testosterone, abnormal hormone balances, thyroid, prediabetes, etc.? Hello, hello. So financial assistance and grants. I will go over this quickly. This is not the forum for that, but there's no financial assistance per se. CNY will have a monthly grant that you have to apply for, but there is payment plans if that helps. Okay. Is there such a thing as taking Omnitrope for too long? Yes. So several things with the Omnitrope. Omnitrope used in the fertility setting, it is experimental. Most data is on Omnitrope given for 2 to 4 weeks prior. We're extrapolating. I don't personally like to see anybody on Omnitrope for more than 3 months at a time. If you have endometriosis, history of cancer, for example, adenomyosis, or anything of the sort, it is contraindicated in those groups because human growth hormone, it's going to stimulate the growth of everything else, not only your eggs. Also, Omnitrope, because it is stimulating growth of the different tissues, um, can cause ovarian cysts. I've seen that as one of its side effects. Also, I like to give Omnitrope intermittently because that's how pituitary and especially hypothalamus hormones work. So I tell my patients do it Monday through Friday, Saturday, Sunday off, because that allows those receptors to get sensitized again. Okay? If you're going to do a prolonged prolonged use of omnitrope, then do it intermittently as well. You can do 2 months, take 1 month break, 2 months, take a month break, but you shouldn't be on it continuously. And that's aside the fact that even though the doses that we use for IVF is small, excess of human growth hormone can make everything grow, meaning you don't really want to end up with ears that big. So going back to the question on the embryo donation, if you have a direct donation of a couple to you, there is some paperwork and a process where you can actually do that, and those embryos becomes yours. And there's a release form that that couple needs to sign, and I think it has to be notarized. Omnitrope for transfer. You could use Omnitrope for transfer because it's going to make the lining grow. Again, human growth hormone, right? It'll make anything inside of you grow, especially tissue that it's normally changing quickly. Ovaries, cancer, unfortunately, endometrial lining. So yes, you could be on Omnitrope for transfer as part of your protocol, even though it's not commonly used that way. 37 AMH of 1.7, tons of supplements. Okay. Um, okay, so I see that Kim has a lot of questions. Going higher on the dose of medication that you're on, it is not going to be the best way to do it. We're actually going backwards. You're going, there's a lot of data showing that older women with lower ovarian reserve do better on lower doses. We're actually going lower doses on everybody because we've seen improvement in outcomes. So going higher is not with the medications is not going to be the way to go. It is actually better to go slower, longer, and looking at those baselines that I was describing. How does your follicle, antral follicle count looks? Do you have a lead follicle at time of baseline? Improving your baseline is going to give you better results and improving your overall health. I see that you being on some supplements. We can definitely discuss a few other things, including PRP. What would be an oral ovulation medicine? Clomid, letrozole, sometimes tamoxifen, depending on the scenario. Okay. All right. Is Serovital saving pregnancy? Yes, I don't see anything inside that supplement that would be detrimental. And sperm motility could affect IVF depending on the severity and whether or not there are other parameters that are abnormal, okay? Morphology, count, that could impact the quality of the DNA inside the sperm, or it could be a sign that we could be handling a deeper problem, not only the motility issue, okay? All right. Well, to sum up our evening discussion, thank you for everybody that has joined me tonight. Um, Anti-aging and wellness and all of that good stuff is not only for those areas that maybe they're describing it, but it can be extrapolated to pregnancy. Another big one that's out there is the stem cell therapy that is being used outside of the United States. Same principle of causing that anti-aging and accelerated rejuvenation, even taking it kind of to the next step in comparison to the platelet-rich plasma. So we discuss platelet-rich plasma, we discuss diet, intermittent fasting, different supplements, PRP, And then I'll just throw out there the stem cell therapy. I know that some of you that have spoken to me have asked me about it, so it is out there. Um, and I'm still researching it a little bit. It's very promising, so I will let you know when I get more info. All right, so may you all be very blessed. I will see you back in 2 weeks, Wednesday nights, every other night in English, and every other Wednesday in Spanish. All right, bye bye.